Welcome to our channel. Today we're diving into a question many of you have asked. Can allergies cause a cough? You know that nagging cough that just won't quit? It can be frustrating and sometimes even a little scary. We're gonna break it down, give you the facts, and talk about what you can do to feel better. Let's explore the facts and treatments together. So, you're dealing with a cough, and you're wondering if allergies could be the culprit. It's definitely possible. You see, when we encounter allergens like pollen, dust mites, or pet dander, our immune system can overreact. Think of it like this. Your immune system is like a security guard, and allergens are like uninvited guests. When these allergens enter your body, your immune system freaks out, sending out histamine and other chemicals to fight them off. This histamine release can cause inflammation in your airways, leading to that pesky cough. It's like your body's way of trying to expel those unwanted guests. Now, according to the American Academy of Allergy, Asthma, and Immunology, allergic coughs are often dry and tickly. They can be triggered by exposure to allergens like pollen, dust mites, mold, and pet dander. How do you know if your cough is from allergies or something else? This is a common question, especially during allergy season when many people experience similar symptoms. Well, there are some telltale signs to look out for. Recognizing these signs can help you determine whether your cough is allergy-induced or due to another cause. First and foremost, allergic coughs are often dry and hacking, rather than producing phlegm. This type of cough can be persistent and irritating, making it difficult to go about your daily activities. You might also experience other allergy symptoms alongside the cough, like sneezing. Sneezing is your body's way of trying to expel the allergens that are causing irritation. A runny or stuffy nose is another common symptom. This happens because your nasal passages become inflamed and produce more mucus to trap the allergens. Itchy or watery eyes are also typical, as allergens can irritate the sensitive tissues in your eyes. In some cases, you might even notice skin rashes, which can be a reaction to allergens that come into contact with your skin. Pay attention to when your cough is at its worst. Keeping a symptom diary can be helpful in identifying patterns and triggers. Does it get worse during certain seasons like spring or fall when pollen counts are high? Seasonal allergies are often triggered by pollen from trees, grasses, and weeds, which can be more prevalent during these times of the year. Do you notice it more when you're around pets, dust, or mold? Pet dander, dust mites, and mold spores are common indoor allergens that can cause symptoms year-round. These are all clues that allergies might be the underlying cause. Identifying your specific triggers can help you manage your symptoms more effectively. Now, it's important to remember that a cough can also be a symptom of other conditions, like a cold or the flu. These illnesses are caused by viruses and can present with similar symptoms, making it challenging to distinguish between them. So, if your cough is accompanied by fever, body aches, or chest pain, it's crucial to see a doctor to rule out any other potential causes. These symptoms are not typically associated with allergies and may indicate a more serious condition that requires medical attention. Always consult with a healthcare professional if you're unsure about your symptoms or if they persist for an extended period. Alright, so you suspect your cough might be due to allergies. What's the next step? Well, it's always best to consult with a healthcare professional for a proper diagnosis. They'll start by taking a detailed medical history, asking about your symptoms, any known allergies, and your family history. Next, they might perform a physical exam, listening to your lungs and checking for any other signs of allergies. To confirm the diagnosis, your doctor may recommend allergy testing. This can involve a skin prick test, where tiny amounts of different allergens are applied to your skin to see if they trigger a reaction. Alternatively, they might order a blood test to measure the levels of allergen-specific antibodies in your blood. These tests help pinpoint the specific allergens that are triggering your immune system and causing your cough. Now let's talk about how to tackle that allergy-induced cough and get you feeling better. Dealing with an allergy-induced cough can be frustrating, but with the right approach, you can find relief and improve your quality of life. The good news is that there are effective treatments available. These treatments range from simple lifestyle changes to medications and even advanced therapies. Understanding your options is the first step toward managing your symptoms effectively. First and foremost, avoiding your allergy triggers is key. Identifying what specifically causes your allergic reactions can help you take proactive steps to minimize exposure. This might involve making changes in your home environment or daily routine. This might involve using dust mite covers on your bedding, which can significantly reduce your exposure to these common allergens. Dust mites thrive in warm, humid environments, so keeping your bedding clean and covered can make a big difference. Keeping pets out of your bedroom is another important step. Pet dander is a common allergen, and limiting your exposure, especially while you sleep, can help reduce symptoms. Consider creating pet-free zones in your home to further minimize contact. Using air purifiers to reduce airborne allergens can also be very effective. High-efficiency particulate air, HEPA filters can capture a wide range of allergens, including pollen, dust mites, and pet dander, helping to keep the air in your home cleaner and easier to breathe. Over-the-counter antihistamines can be your best friend when it comes to allergy relief. These medications are designed to block the effects of histamine, a chemical your body releases during an allergic reaction. They work by blocking the effects of histamine, which, as we learned earlier, is the chemical responsible for those pesky allergy symptoms. Antihistamines can help reduce sneezing, itching, and runny nose, making it easier to manage your cough. Understanding how histamine affects your body can help you appreciate the importance of these medications. Histamine is part of your body's immune response, but in the case of allergies, it can cause symptoms that are more of a nuisance than a help. Nasal corticosteroids, available in both over-the-counter and prescription strengths, can help reduce inflammation in your nasal passages, relieving congestion and cough. These sprays are particularly effective for treating nasal symptoms and can provide long-lasting relief. If your cough is particularly bothersome, your doctor might prescribe a cough suppressant to help you get some rest. Cough suppressants work by reducing the urge to cough, allowing you to sleep better and recover more quickly. For more severe allergies, your doctor might recommend allergy shots, also known as immunotherapy. This treatment involves regular injections of small amounts of the allergen, gradually desensitizing your immune system and reducing your symptoms over time. Immunotherapy can be a long-term solution for managing severe allergies and improving your overall quality of life. All right, let's talk about some practical tips for managing and preventing that allergy-induced cough. Allergies can be a real nuisance, especially when they lead to persistent coughing. But with a few proactive steps, you can significantly reduce the impact on your daily life. First and foremost, keep a close eye on pollen counts and try to limit your outdoor activities when they're high. Pollen levels tend to peak in the morning and on windy days, so plan your outdoor activities accordingly. You can use various apps and websites to monitor pollen levels in your area. Shower and change your clothes after spending time outdoors to remove any lingering allergens. This simple step can prevent allergens from spreading throughout your home and reduce your exposure. Make it a habit to wash your face and hands frequently as well. Regularly clean and vacuum your home, paying special attention to areas where dust mites tend to accumulate, like carpets, bedding, and upholstered furniture. Use a vacuum cleaner with a HEPA filter to ensure you're capturing as many allergens as possible. Don't forget to wash your bedding in hot water at least once a week. If you have pets, consider keeping them out of your bedroom and bathing them regularly to reduce dander. Pet dander can be a significant trigger for allergies, so maintaining a clean environment is crucial. Brushing your pets outside can also help minimize the spread of dander indoors. Using a humidifier can help add moisture to the air, which can soothe irritated airways and reduce coughing. However, be mindful of the humidity levels in your home. Too much humidity can promote mold growth, which can exacerbate allergies. Aim for a humidity level between 30% and 50%. Stay hydrated by drinking plenty of fluids throughout the day. Water, herbal teas, and broths are excellent choices. Staying hydrated helps thin out mucus and makes it easier to cough up, providing relief from that persistent cough. This helps thin out mucus and makes it easier to cough up. Additionally, consider using throat lozenges or sprays to soothe your throat. These can provide temporary relief and make it easier to manage your symptoms throughout the day. Remember, managing allergies is an ongoing process, and it might take some trial and error to find what works best for you. Keep a journal of your symptoms and the steps you take to manage them. This can help you identify patterns and triggers, making it easier to develop an effective management plan. Be patient, be proactive, and don't hesitate to reach out to your healthcare provider for guidance and support. They can offer personalized advice, and may recommend medications or treatments that can help you manage your allergies more effectively. Remember, you're not alone in this, and with the right approach, you can keep your allergy-induced cough under control. So there you have it, everything you need to know about allergy-induced coughs. Remember, knowledge is power. By understanding the causes, symptoms, and treatments for allergy-induced coughs, you can take control of your health and find relief. If you're struggling with a persistent cough, don't suffer in silence. Check the description for consultation with the specialists and health professionals today.